This is a WBTA special report, COVID-19, a local view. Good afternoon, I'm Dan Fischer. Joining me in the studio this afternoon are two physicians from United Memorial Medical Center, Dr. Tara Gellasch, who is the Chief Medical Director at the hospital, and Dr. Danielle Notebaert, who is Chief of Emergency Medicine at UMMC. Also with us here in the studio is Tim Yeager, coordinator of Genesee County's Emergency Management Agency. And joining us via telephone is Mary Hamilton, public health educator with the Genesee Orleans Health Departments. All of you, thank you very much. Your time is valuable, I realize, and you have been extremely busy, and we appreciate your being here. What is the latest status of the virus here in Genesee County?
So as of today, we are trying to figure this situation out. It's a very fluid situation. We just want to make sure the media is getting the most accurate and up-to-date information possible. So it is, in fact, 8.
All right. Mary, thank you very much. I want to put in this right now that we really want to take your questions. Our number is 344-1490. You do not have to give your name, and we don't expect you to go on the air with us, but we want to know the questions that you have that pertain to COVID-19 here in Genesee County and Batavia. So let me at this point bring in one of the doctors, and Tara, you were here first, so we're going to put you up first. You are a chief medical officer at United Memorial Medical Center. How would you describe the operations at the hospital today as opposed to a month and a half ago?
Well, I think we have, for the past several weeks, we have been in incident command mode, which basically means a preparation state, allowing us to assess our current resources and determine what the best way to redeploy those resources should we start to see a wave of COVID patients who require hospitalization or even critical care. And so that's essentially what we've been doing. We have consolidated some services, so some of our outpatient services have been streamlined. We have been redeploying some of our nursing staff as well as providers and support staff to be able to staff the COVID evaluation tents that we've seen in the hospital set up. We've also redeployed some staff to our Batavia urgent care site. And so really what we've been doing is allowing ourselves to take time to prepare and think about our resources in that context.
Dr. Notebaert, let's talk a bit about the triage tents that are set up at the hospital, and for what purpose?
Sure. Those tents are set up as a measure to protect our patients, our staff, our hospital, and to provide a safe environment for screening patients who would be presenting to the emergency department. So people are directed if they have a fever, they think they have an infection, they have respiratory symptoms, they're concerned they might have COVID, they are directed into the tent triage line where they go through a 3-step process of being evaluated. So not everyone who presents actually needs to be tested for COVID, but there's a lot of people who probably need to be home on self-isolation. They need some good instructions as to what to be looking for, how to take care of themselves, how to protect their community, and we can provide that as well. We can give them work notes. We can also take care of other things that are coming through the line that might have been deflected in there because they could potentially be COVID, but it's still more or less an urgent care. We can swab you for strep throat. We can look in your ears. We can listen to your lungs, provide respiratory treatments. So we're still treating it as an extension of the emergency department and still trying to provide care as best we can while keeping people safe.
Is it still a fair note to make that there is no definitive system that lead you to think it's COVID-19?
A definitive symptom?
Yes.
Right now, in this day and age, I would think if you are sick, if you are having fever, chills, cough, sore throat, you feel lousy, maybe even diarrhea, if you feel like you're sick, I would presume you could have it, and you should stay home and isolate and manage your symptoms.
If you wanted a test, we have been told that folks should contact first their primary physician, and they would then direct to the hospital facility. Is that correct?
Correct. Still the safest maneuver is to contact your primary physician, have a discussion about your symptoms, whether or not they feel they know you best and they know your past medical history, and they can help guide you safely as to whether or not you should be managing at home, or maybe you're in a high-risk category, or your symptoms are more concerning that maybe you should be seen and screened at the tents.
Let's pose this question to you, Tim. Tim Yeager is here, coordinator of Genesee County Emergency Management. This is one of the questions that were phoned in. Are you looking at the old St. Jerome Hospital or the VA for the possible use of additional hospital facilities?
It's funny that you asked that because we started last week, actually the week before, starting to evaluate surge capacity for the hospital, isolation and quarantine locations. So this week, actually, we'll be out looking for other locations, and St. Jerome is something that we're going to take a look at. We'll be speaking with Dan Ireland shortly to look at that. I've reached out to the VA medical campus to see if they have any capacity there. Obviously, their customer base are veterans, and we want to make sure that they're sustained themselves before we start asking for them to take any patients from Genesee County.
Mary Hamilton, you have been, the health department has told us when there are patients at United Memorial Medical Center being treated for COVID. Do you have any at the VA that you know of?
Not that I know of. We don't really like to identify locations of the hospitalization since we do report Genesee and Orleans County. Some of our positive COVID patients may be recovering or hospitalized up in Orleans County. Some may be down in Genesee County. So we don't really like to identify just for personal information.
Right.
Because it is such a small community.
I just wanted to clarify those pronouncements about patients treated at UMMC were made by Dan Ireland of the hospital, president of the hospital, and not by the health department. But, Mary, another question that we are getting a lot. Why is it, in the case of Erie County, for example, right next to us, the health department there is identifying patients and the particular town or village where they reside? That's something Genesee County has not done. Can you explain that?
Yeah, so that's a really great question. We do hear the community, so we don't want to say that we're not listening to our community members. We hear the frustration, but from our standpoint, we realize that our counties are much, much smaller than Erie and Monroe County. So when you're dealing with positive cases, and we have, at the moment, less than 10, so that's a very small sample size. And so, like I said, our communities are very small and word spreads around very quickly. And so we're essentially trying to protect, confidential information. We're trying to protect that individual.
What about contact tracing? What does that really mean?
So that is a really great question, and it's a fun process that our fantastic nurses and epidemiology team, they're the ones who manage the contact tracing. Essentially what that means is they reach out to the positive case and they list and identify each person they may have had close contact with since the day of their symptom onset. And so it's a very detailed process and it can be very lengthy. And so they go through each person, get their contact information, and then from there, the nurses and the epidemiology team, they have to reach out to those subsequent contacts and, let them know they may have a potential exposure and, go through all of the details with them as well to see if they're symptomatic. They may be placed under precautionary quarantine or mandatory quarantine based on the extent of their contact with the positive case. And I just want to reiterate that close contact essentially means within 6 feet of that positive person.
Well, that leads me into what I wanted to tell people about the gathering we have in our studio here. We have separated the doctors as much as possible. Mary joins us on the telephone. And unfortunately, Dr. Danielle, you're behind one of our computer monitors, so please excuse my inability to see you while we talk. But with that, I'm going to ask the next question of you. What are senior citizens supposed to do about food, especially when you have a pre-existing condition? I think the questioner is asking about food coming in.
I would say that restaurants are doing a great deal of work for the community by trying to stay open and still provide services, still provide work for their employees. And I would think they're screening their employees to make sure no one's coming in sick. I'm sure they're using good health measures, washing their hands, not touching their face, and doing their best to keep the community safe.
We are at 344-1490. If you have a question for any of our guests, they include Dr. Danielle Notebaert from United Memorial Medical Center, Chief of Emergency Medicine, Dr. Tara Gellasch, Chief Medical Officer at UMMC. On the phone with us is Mary Hamilton, a public health educator from the Genesee Orleans County Health Departments, and Tim Yeager, coordinator of Genesee County Emergency Management. Dr. Tara, another question from a listener. If we can have the virus with no symptoms, how can we ever feel safe and be with other people?
I think that's an excellent question, and I think it's something that we're all asking ourselves, and I think this is really where the social distancing becomes so critical. We absolutely, are seeing, particularly young and healthy people have a viral course that does not include a lot of symptoms, and unfortunately they can be at risk of passing this along to individuals who could get quite sick, and as we're seeing, some deaths as well. So I think this is where it becomes so critically important that we follow the guidance of the Department of Health and really make sure that we're staying home whenever we can. Make sure that when we are out and about that we are keeping 6 feet away from people, that we are washing our hands regularly and washing the surfaces in our homes that we're touching frequently, door handles and that type of thing. So I think that it's an excellent question, and it is certainly a time of uncertainty, but there are absolutely ways that we can be protecting ourselves and the ones we love.
Is social distancing still the best defense, would you say?
Well, I think it's a defense. I think that it's certainly a very good place to start. If we are not in contact with people who, are going to have the virus, we're not going to get it, and we also can't transmit it to others. So I think it's absolutely a great place to start. Hand washing is also critical because we know that if we get the virus on our hands and then we touch our own face, this is a great way for us to get it and to give it to others. So I think that's certainly another thing that's going to be our best course of action at this point.
Leads us to this question also from a listener. If someone in the Postal Service, your mail carriers, going door to door throughout the community is possibly COVID-19 positive, or someone that they've delivered to, can you get sick from handling your mail?
At this point, we don't have evidence that someone's going to get sick from handling their mail. I think what we are relying on is for folks to really not go to work when they are sick, and that is the best advice that we can give to people, and that includes our postal workers and everybody else, is that if we are sick, we should not be going to work because we are at risk of exposing people. But we do not have good evidence yet on the virus's ability to live on other objects and for how long that happens. So I think, as Dr. Notebaert alluded to, we can certainly try to, wash things before we handle them. And even some people may even choose to wear gloves, but there's no proof that that's going to be helpful at this time.
We're going to talk some more about personal protective equipment, and Tim will bring you in on that. But first, I want to remind you that you can ask a question of our guests. We're at 344-1490. You don't have to go on the radio. Our producers will take your questions and write them down and bring them in to us. And we are going to take a quick break and be right back.
At the Golden Coin Dry Cleaning and Laundromat, they have dryers that will dry your clothes fast. They also have newer dryers for your heat-sensitive garments. Plus, they do repairs on shoes, purses, leather bags, and so much more. Don't forget, they have same-day wash and fold services available and a professional dry cleaning service. You can get all this with free coffee, free Wi-Fi, television, a comfortable sitting area, and a knowledgeable and friendly staff. Visit the Golden Coin Dry Cleaning and Laundromat on Main Street in Batavia.
Genesee Community College takes you where you want to go. Just ask GCC's national champion soccer team, or the hundreds of nurses working in area hospitals, or tech heads learning to fly drones, or the actress memorizing her lines, or budding scientists focusing on a strand of DNA. Make GCC part of your journey. Meet your success coach at GCC's Student Success Center and tour the new Call Arena. Click genesee.edu or stop by the college's new Student Success Center.
When it's time to think about a pre-owned car or truck, it's time to visit Ken Barrett Chevrolet Cadillac. At Ken Barrett, we have the finest selection of locally owned trades and hand-picked auction vehicles, always priced below Kelley Blue Book. Our pre-owned vehicles are fully reconditioned before you drive them. You should expect that from your dealer, and that's exactly what you get at Ken Barrett Chevrolet Cadillac. At Ken Barrett, our factory-trained service and parts staff will be there for you with free state inspections for as long as you own your car. And to help make your purchase possible, our expert staff specializes in securing the most favorable financing terms available. At Ken Barrett, it's our mission to provide you and your family the best, safest, and most dependable vehicles at the very best price. Ken Barrett Chevrolet Cadillac, West Main Street, Batavia, 344-1000. On the web at kenbarrett.com.
We're back to our special COVID-19, a local view on WBTA. With us, we're so pleased to have these folks with us who have just been so busy and found the time somehow to give us an hour to go on the radio today. We have with us Dr. Tara Gellasch, Chief Medical Officer at United Memorial Medical Center, Dr. Danielle Notebaert, Chief of Emergency Medicine. We have Tim Yeager, Genesee County Emergency Management Coordinator, and we also have with us on the phone Mary Hamilton, Public Health Educator with the Genesee County Health Department. I have not read these questions ahead of time. They were just brought in, so bear with me. How specifically does this virus interact with diabetics, since this is more respiratory? I think that the person is asking, since this is a respiratory illness, how should a diabetic be more concerned, or does it have no impact there?
I can start with that and let Dr. Notebaert pick up if I miss anything. But really, this is more about diabetics being at higher risk of all types of infections. And so it's nothing specific about COVID that is making a diabetic more susceptible than other people, other than their just general higher risk of infection. And so we know that diabetics will have a harder time fighting off infections like pneumonia, the flu, any type of infection. Oftentimes diabetics will struggle with, and it essentially similar to like an immunocompromised patient at times. And so this is certainly a more vulnerable population and a group that we're very concerned about wanting to keep safe.
Dr. Notebaert, what do we mean by an immune-suppressed patient, or a patient whose system requires them to be far more careful than the average person about acquiring illnesses?
So this is generally a patient population who might have something like cancer, where their white blood cells might be impaired. They might be getting chemotherapy, which will impair their immune system. People with inflammatory diseases like rheumatoid take medicines that can weaken their immune system. Lots of things, diabetes as well. And those people might not be able to have as strong of an immune response against the virus. So they're going to be more at risk for having a more severe response.
We talked about the virus and how if it can live on surfaces. What about clothing?
So I'm going to have kind of a similar response to that. We really don't have a lot of data supporting that it is living for extended periods of time in clothing. That said, I think we do see a lot of healthcare workers taking their clothes off when they go home and putting them into the laundry immediately, rather than continuing to wear those clothes in their home environment. Again, that is a precautionary step that we see people taking. We do not have data to support whether or not that is changing the transmission of the virus.
So does a standard washing clean the clothing of the virus?
Absolutely.
Okay.
And one of the things, the other way that we are protecting our healthcare workers is they are wearing gowns. And so when we have patients that we're taking care of who we suspect COVID may be, maybe the cause of their symptoms, or if we know that COVID is the cause of the symptoms, healthcare workers are wearing gowns when they enter those rooms, disposable gowns that they take off, as they exit the room as well. So that limits the exposure of their clothing to the virus as well.
It kind of answers this caller's question about laundering, and she was wondering, will a hot dryer kill the virus? We're saying that just standard
washing and drying would
probably
be fine.
Do it.
Mm-hmm.
And I was just going to elaborate that when you're touching surfaces like the food containers that come in, when you're touching your mail, when you're touching clothes and things like that, if you then wash your hands effectively before you touch your face or do something else, that is your best defense.
Tim Yeager, Emergency Management Coordinator. So much has been talked about PPE, personal protective equipment. Right now in Genesee County, do you feel confident that we have the equipment, the gowns, the masks, the ventilators, at least for the time being and the foreseeable future?
I think that's a difficult question to answer. I mean, when I left the office half an hour ago, we were okay. As we see this change hour to hour, day to day, I know that the first responders in the healthcare systems, as today, have adequate supplies. There's probably many out there that would want more to have some reserve in anticipation of what may possibly happen. It's our job to do the best that we can to solicit their needs and communicate with them to find out what we refer to as a burn rate. So it's basically how much are they using per day, per week, per month. But that can change because it's all based on the community spread and how much we're going to be affected by this. So we just keep looking at that, monitoring that, working with the state. We have adequate supplies on hand, and we continue to resupply as needed. But I think it's just a word of caution of PPE out there that's being used and how it's being used, and making sure that the proper guidance is understood and implied to everyone.
Okay. Tim, where's the county getting its supplies from? Are all of them coming in from the state, or are you dealing directly with any private vendors?
Some private vendors. Vast majority is coming from New York State. We did have some stock on hand, as we should. But it is mostly New York State driven. But we are reaching out to vendors. Vendors are reaching out to us. And we continue to evaluate those options and want to make sure before we do purchase anything that it's adequate for the healthcare providers before we do anything, and then make sure that we're adequately looking at the cost and the effect that we have locally.
Any evidence of price gouging from your standpoint?
Oh, yes, absolutely.
Really?
Oh, the price of everything has gone up. So we typically work on New York State contract pricing, and we're still able to supply and get some of those supplies through New York State contract pricing, but most of the stuff is pretty much everywhere and anywhere. So we're very, very cautious as we move forward.
Wow. I wouldn't have expected that, although I guess I'm not surprised. There's been such an outpouring of support from the community for folks like you, for the doctors, for the nurses, the other healthcare professionals, the first responders, from private companies or private citizens. But yet, perhaps it's just our American system that if there's an opportunity to make a buck, someone will try to do it. There was a question from a listener, Tim. Why don't nurses' aides for home nursing have the gloves and other supplies that they need, or are they getting it?
They should be getting it. Again, it's one of those fine lines between is that patient been exposed? Does that patient have any risk that we've got to look at before we use the PPE? You know, obviously everybody can't walk around with N95s on. It's just not practical. We need to maintain that for the first responders in the healthcare system. So I'm not aware of any medical healthcare profession that is in need of those items. Many of those have worked with their own private vendors and are able to secure what they need to secure. If they don't, they're obviously able to contact us, and we'll do the best that we can to supply them.
Mary Hamilton, I'll pose this question to you. So much of the projections about this disease, both nationally and statewide and even locally, is being made by statistics gathered through testing. But the testing appears to be limited. Do you have a handle on how many tests have been administered in Genesee County?
So that number, I have the number as of Friday. And so as of Friday, let me gather that real quick. 75, there have been 75 negative tests done. We can report that. The Genesee and Orleans County Health Departments, we are reporting on negative test results. So we're at least providing some sort of test results to our community. We don't want to elicit all of the test results because some of them are positive, and it's impossible to really track every single test that's being done. So we do want to provide a little bit of information to the community in regard to that, but testing is very limited, and unfortunately we cannot test every single person. So we are keeping the tests, for the vulnerable population. So for the folks who are over the age of 65 or have that underlying chronic disease that, may make them more susceptible to severe medical reactions to the virus, which would make them not recover as easily as just a healthy individual.
Mary, I'm no statistician. That's a specialty in and of itself, but it just seems to me that if we have been able to test 75 people in a 2-county area, that just isn't enough, I would think, to form any conclusions or to plot any projections. Would you agree with that?
I would agree with that, and that's 75 numbers specifically for Genesee County.
Okay. Let me ask you this. When and or how are we going to be able to determine, with so few tests, that we have begun to flatten the curve here that we hear so much about, that we have reached our peak, or what the governor calls the apex of this outbreak?
So again, that's a tough question to answer, but what I can say in supporting that is really practicing social distancing is going to flatten that curve. So social distancing, proper hand washing, just staying home. I know it's difficult. It's a small sacrifice, and we're not used to doing that. And, on a normal day, if we were doing a radio show, I would be more than happy to sit in the closed room with the rest of the panel, and yet the times are changing, and so we have to adapt to these changes. It is only temporary. This isn't going to be a forever change, but we just need to adhere to the guidelines, and that will flatten the curve sooner rather than later.
Well, let me just say that walking into a radio studio anytime can be a dangerous thing. But I just, does the virus always stay active but yet dormant in our bodies if we have never had symptoms? That was a question from from a listener, and I'm just trying to decipher that. Does the virus always stay active in the body, or what happens to it once the initial crisis has passed?
So I'm just thinking through that question a little bit. The way I'm interpreting that question is once we have been exposed to it and have run through the disease course, does it stay active in our bodies like maybe chickenpox? That is not our understanding of this virus. Our understanding of this virus is that if someone is exposed, that their body would create antibodies to the virus, and that they would essentially eliminate the virus from their body. So at this point in time, and that's similar for other coronaviruses, which is the family of viruses that this COVID-19 is among. So our understanding would be that your body would create antibodies to it and would eliminate the virus, and it would not be in your body anymore.
And that's based on our knowledge of other viruses
Correct.
that have been
Correct.
Identified. 344-1490 is a number to call. My lovely wife is acting as our producer today, and I should be able to read your handwriting. Our other healthcare professionals, such as ophthalmologists or physical therapists, are they also required to be using the protective gear? Dr. Tara, you want to take that one?
So anyone who's having patient encounters with patients who have symptoms should be using protective gear, absolutely. I do know that many physicians and medical providers who have been deemed to be not providing essential or urgent care have actually cut back significantly on their in-office visits, conducting many visits through telephone visits or even telemedicine, like using Skype or FaceTime as a way of interacting with their patients to reduce the risk to their patients as well as the risk to themselves and their staff. But certainly if they're having direct contact with patients, they would need to follow the same guidelines on using protective equipment.
And I would think that this would apply, Dr. Danielle, to dentists as well.
Sure. They are also, I believe, not taking care of routine cases, just working on the more emergent issues that present. My experience with dentists is they are always fully geared up in masks, gloves, eyewear to protect themselves.
And they hurt. They hurt us.
That's not my experience.
The one joke that I remember about dentists and Novocaine doesn't kill pain, it postpones it. What about elective surgery? United Memorial Medical Center announced this at least a week ago, if not farther back than that, that elective surgery has been put on hold. Can this put someone at any risk? I mean, what do we really mean by elective surgery?
So it's actually can be broadly defined, but any surgery that is not, by delaying the surgery, isn't risking that patient's life or a risk of serious consequences could be considered elective. But there are lots of surgeries that are not elective. And so, yes, United Memorial has put on hold elective surgeries. And right now, we don't have a date yet for when surgeries will begin to be rescheduled. The governor has also weighed in on this and requested that all hospitals delay elective surgeries, and this is for multiple reasons. It's reducing the use of protective equipment unnecessarily. It is also reducing traffic into the hospitals as far as the number of people coming in and out, which are, again, is an exposure risk both to those patients and to the hospital staff and providers. But our doors are still open to deliver babies, to do C-sections, to do emergency surgeries like appendicitis and gallbladder surgeries. And so absolutely we are still there for the community for emergency cases, but elective surgeries will be postponed until we're through this crisis.
And we will get through this crisis, but do you anticipate a baby boom 9 months from now?
Absolutely.
We're going to take a quick break here. We're at 344-1490. We have several questions to get to, and we'll get to many of them right after this break. Buy now, get more later. Introducing the Pizza Savings Bond from Main Street Pizza Company. Buy a $100 pizza bond for $75. The bond will be valid only after Main Street Pizza Company returns to full seating capacity. Main Street Pizza Company, available now for takeouts.
Jane, hi. Wow, this is a nice place.
Sally, great to see you. How have you been?
Well, I could be better.
Honey, what's wrong?
I can't seem to ship.
What? Well, just order some prune juice or something.
No. I said I can't ship.
Oh, why don't you do what I do? Go to the UPS store in Tops Plaza.
The UPS store? I can do that.
They take care of everything. Boxes, packing, and of course, they ship.
The UPS store in the Tops Plaza, Batavia. Do you find you're spending more time worrying about what your computer is doing to you than for you? Updates that interrupt an important project at the worst possible time. Fear of another troublesome virus you may not be protected from. Wouldn't it be great to have an affordable and effective maintenance plan for your computer?
Marchese Computer Products, your neighborhood IT department, has just the managed plan for you, all for less than 35 cents a day. Your computer will be kept up to date with the latest antivirus protection and the latest Microsoft Windows updates, all automatically. No need for you to do anything, but call Marchese Computer Products. Google them right now. For less than 35 cents a day, enjoy the peace of mind that your computer is ready to work for you.
Marchese Managed Services is state-of-the-art, safe, and ahead of the curve. Call Marchese Computer Products and ask the experts about their managed services plan.
We're back on COVID-19, a local view on WBTA, an opportunity for you to ask questions of our experts, and we've been able to assemble quite a panel here, and we're just so appreciative of them giving us an hour of their time to come over here to the station and talk with us. In the studio, we have Dr. Tara Gellasch, Chief Medical Officer at United Memorial Medical Center, and Danielle Notebaert, Chief of Emergency Medicine. Also joining us is Mr. Tim Yeager, Coordinator of Genesee County's Emergency Management, and Mary Hamilton, Public Health Educator for the Genesee County Health Department. Tim, will go to you for this question. Does your office, the Emergency Management System, have PPE for agencies in the human services realm? I'm thinking of the ARC, who has people in residential homes that need to be cared for. Perhaps they're bedridden. Do you have equipment for them?
We do, yes. From ARC folks to Meals on Wheels folks, almost anybody that, and we're learning too, as some of those agencies out there, and they're
really anyone who has direct contact, necessary direct contact.
Correct. I mean, it's any. Unfortunately, it's those agencies. We want to make sure that they're protected appropriately. Again, levels of appropriate PPE is somewhat subjective for some folks, so we're trying to educate as much as provide that equipment. And again, it's just to make sure that there's enough equipment to go around so that we use that. We have been in touch with the coroners of Genesee County and the funeral directors of Genesee County to make sure that they have a plan in place, they have appropriate equipment to deal with the crisis as well.
We have not yet, fortunately, and let's hope it stays this way, reached even the level where it is in New York City. I mean, I understand New York City is a much larger community. I don't know what it's, 7 or 8 million people. But still, it seems to me that the percentages there are still higher than they are here because probably the population density, I'm guessing. But are we prepared to reach those proportions? There was an image on television that just stuck with me, and I don't mean to be morbid, but bodies were being stored in refrigerated trailers. I mean, that's a frightening possibility. Mm-hmm. Are we looking at that here?
Unfortunately, yes. And it's not just this event. That's a mass fatality planning objective that we've always looked at, whether it be typically transportation or it could be environmental, a storm that comes through. So those are things that we look at. It's not comfortable for anybody to have those discussions, but it's a realistic discussion. So we do look at those things as well.
So much time is spent in your office, Tim, because I've covered your office for so many years, dealing with different scenarios. Did this type of scenario ever come up? A pandemic, epidemic?
Absolutely. It's been talked about for years. I think among the emergency managers field, I think that we've thought that it was, and it has been always on our radar, but I think it was at a low priority for many. Just recently, cybersecurity has moved its way up the list of a threat against government primarily and private industry. But pandemic planning, flu planning, mass casualty, things of that nature, those things have been discussed, plans have been put in place, and that's why I think we're able to react to this better and continue to react to that. Again, we, from the emergency management field, we, as most, healthcare agencies and first responders look at things and we prepare for the worst. And I used to say hope for the best, but that's really not a good strategy, so now we just pray for the best.
Mary, we're going to bring you in on this. This is a question from a listener. Are you, meaning the health department, notifying employers if an employee tests positive?
So we will notify them if it is deemed appropriate. We're not going to disclose confidential information. We've heard of some employees who have contacted our health department, with the, I don't want to say complaining, but basically saying that they feel the need or the right to know if someone in their office is tested positive. And by law, we are not allowed to identify positive cases.
Would you say, Mary, though, that is a fair concern? I mean, we know how rumors spread, especially in a small community. And in a small business, you're going to find out if someone in your office or your shop has tested positive, and you are unable to confirm that. Am I reading it correctly?
We are unable to confirm the identity of the individual, but we can notify the company if there is a positive case.
Oh, okay.
And essentially, we would ask the company to, let their employees know to just self-monitor. So self-monitor for symptoms. So if they notice a fever, cough, shortness of breath, or tightness in their chest, to contact their primary care provider.
Let me ask the doctors this. We hear a lot about the magic of 14 days. I'm not exactly sure what that magic is or what it's telling us, but are we to assume that this virus doesn't last more than 14 days?
Well, Danielle and I, Dr. Notebaert and I are looking at each other saying, who's going to take this? So it really has to do with the incubation period and the time from when someone may have been exposed to the virus. So if they've had a high-risk exposure, we would expect someone to exhibit symptoms within those 14 days. So that's really what that is about. The normal course of illness is also typically less than 14 days, but of course that's not always the case for folks who are suffering from severe illness. But typically we would expect if someone does develop symptoms that those symptoms would have resolved certainly within 14 days, and often it's shorter, closer to more of a 5 to 7 day resolution of symptoms.
You can tell by when the symptoms begin to resolve, but do we know how long that virus is still there or how long someone is still contagious?
So we have actually recently gotten new guidance, I believe on Saturday, from the Department of Health, that if someone is 72 hours without a fever and without symptoms, that they are good to actually to be released from quarantine and to return to normal activities. And so that's really our advice at this point, is that 72 hours without fever or symptoms.
The main thing is without symptoms, and no Motrin or Tylenol to control the fever.
That also just came out this past weekend. Maybe it's been known to physicians much longer, but the ibuprofens of the world are not to be taken for this?
I don't think that has been.
It's not a decisive thing. I think there were some concerns with the use of Advil, Motrin products to control symptoms, and I believe it was some concern about interactions with the kidneys. But I think that we can be using Tylenol very safely to manage symptoms, and so that would be our recommendation at this point in time.
Seems to be the hospital's go-to pain reliever without getting into something particularly heavy.
Yeah.
Okay. Talk about a minute young people and this virus. We see the spring breakers in Miami and elsewhere gathering like they always have and thinking that this disease is somehow not going to strike them. This can strike anybody.
Correct.
It can strike anybody, and I think it's just challenging. Young people in their late 20s or early 20s and late teens often have that sense of invincibility that we can all kind of remember, and I think don't always have the foresight to think about, the week after spring break I'm supposed to go to Sunday dinner with Grandma, and I could be the one who brings this to Grandma, and Grandma might not recover. And so I think this is where we really are asking our community to be willing to, sacrifice and think about those individuals who are going to have a poor response to this virus and it could potentially be fatal or result in some lifelong issues. Pulmonary issues is a big thing that we're seeing, is some pulmonary scarring, so lung scarring for folks who recovered. So we have to keep that in mind, that we are really trying to keep our loved ones safe.
These long-term effects, are they, or have you seen those types of effects with other coronaviruses or what we call the flu or the common cold? I mean, is that something particular to this COVID-19?
Yeah. Well, fortunately here in the U.S. we didn't get a ton of the other coronaviruses. I mean, MERS and SARS sort of stayed, really didn't hit us quite the same way. We did a lot of preparation at those times, but we didn't see those come to the U.S. the way we're seeing COVID-19. I think with any, with the flu, that certainly sometimes when folks get a flu virus, they may, depending on the course of their illness, it's not the flu, it's the bacterial infections that come after that. It's the effect on their organs that can come from that superinfection that can result in a permanent injury to their body, essentially. But it's not just the flu itself; it's all the things that come with that severe flu illness.
Did you want to weigh in on that, Dr. Notebaert?
I think Dr. Gellasch did a wonderful job.
There you go.
Thanks.
Very good. Some of us, Tim Yeager, remember those younger days more easily than others. I mean, it's more difficult for us to go back that far, especially with Tim. Goes way back. We have time for perhaps another question or two at 344-1490. You do not have to give your name. We will pose your question to our panel of experts, and once again, we really do appreciate their giving us the time. I ask you this collectively. All of you have been in your fields here for a while. Have you ever seen anything like this, and will we come out of this okay? And let's start with Danielle. Let's begin with you.
I've been doing this for 20 years. I have never seen anything like this. I'm pretty sure in my career we will not again, hopefully. I will retire before then. For me, it's terrifying because it's my colleagues, our nurses, our staff that are on the front line, and that's the first time we've really been faced with something like this. So the fear can be overwhelming. On the other hand, we've seen amazing community outpouring of support and appreciation, and the amount of just the whole hospital community pitching in and doing what they can has been really amazing to see.
Tim Yeager, Dr. Notebaert made mention of the showings of support. We've seen it all over the country. You have direct contact with our first responders hourly. Is that message getting through?
It is. I think they're all concerned, just like every citizen is, of the event and how severe it can affect our daily lives and long term and short term. So, we're going to get through this. I think out of every disaster, we always try to look at some positives that may come out of that. And right now, it's probably family spending some time with family. I think it's neighbors checking on neighbors, which we really need to do more of. I think we kind of grown away from that and more worried about technology and what's in our hand instead of talking to the person next to each other. So even though we're apart, I think we're going to get through this together as one. So the support of the first responders have been extremely cooperative and very focused on what their mission is, and it needs to continue that way. But we're going to get through this. Everybody's just got to make some sacrifices short term for the long term goal.
Mary Hamilton, I want to ask you the same question, and I'll also ask it of Dr. Gellasch about how it is we're going to get through this. But I do have one more specific question, and we've gotten this in a few different forms today, Mary. If you're working for a company, is the company obligated to tell their workers that one of their colleagues has tested positive?
I don't believe so, to my knowledge. I think it's just encouraging and notifying the staff to self-monitor to see if they do develop any symptoms. I know that's pretty vague, and that may not be the answer that you're looking for. But we just want to make sure that we're really protecting that individual. So that really is where all of this is stemming from. So we just want to make sure we're protecting the individual and not outing any specific person.
Mary Hamilton, with the health department, what has been the consensus of opinion among your colleagues as to how we're going to come out of this, and will we come out of this better than we are now?
So I definitely think that just the status of the health department, everything is so different and very similar to how the hospital is functioning right now. We're also in the incident command structure, and so all of our staff have been reassigned from their daily duties to focusing more on COVID-related duties. So it's just a very interesting twist. Everyone has come together so nicely, though. It's so nice to see people in different roles, and everyone plays very well together. We have a very great department here. So it's just been a great learning experience. Certainly it's not, what we want to be doing, but I do feel like we are going to grow from this, as a department, as a community. Just on a personal note, my husband and, we have a young son, and we love to go out for walks, and it's just interesting to see how people will stop and talk to you for a minute, but from a distance. And so we're still having that communication, but there is that distance between us, so we're doing it safely. And there is a lot more verbal communication going on, which is really nice to see.
And Dr. Gellasch, Chief Medical Officer at UMMC, specific question for you first, and then we'll round out with the question I've been asking our other guests. The word again about ibuprofen. When is it safe to use it for symptoms of COVID, and when is it not?
I think honestly, I'm going to say I think the jury is a little bit out on this. And so at this point in time, I would recommend that we focus on using Tylenol for our aches and pains and fevers at this time. I just don't think that we have enough concrete evidence about the ibuprofens to say one way or another right now. I don't think there's concrete evidence to say that it's unsafe. So if you unwittingly used ibuprofen or Motrin, I do not think you need to be concerned. But if you can avoid it, that's a reasonable choice at this time.
How will we come out of this? Will we be better as a society?
I actually am feeling very optimistic that we're going to be better as a society. I think that We did go through preparation. I was mentioning before during SIRS and MERS and Ebola most recently. But I think that this has really caused us to take a pause and really look at how all of the various agencies interact with our health systems. Here at United Memorial Medical Center, we're part of Rochester Regional Health. That's a relatively new affiliation. We've really learned how to partner within the system during this crisis. And we're asking a ton of our staff and our nurses and our providers. We have providers who are outpatient providers who are brushing up on critical care skills, on hospitalist skills, so that if they're needed, they can come and help take care of patients in the hospital where they're the sickest. And so I think that some of these things we're going to learn to be able to do it better and faster should this ever happen again.
I want to thank all of our guests once again for the time that they've given us today on the air. Dr. Tara Gellasch, Chief Medical Officer at United Memorial Medical Center, Dr. Danielle Notebaert, Chief of Emergency Medicine at UMMC, Tim Yeager from the Genesee County Emergency Management Office, and also Mary Hamilton, Public Health Educator with the Genesee Orleans Departments of Health. Thank you all very much. I would like to say that we won't have to do a program like this again. Let's put it this way. If we have to, we will. And stay well, maintain the social distance, wash your hands. I also agree with our guests. We will get through this. This is WBTA Batavia.